Opposed? Carried. Entertain a motion to approve the minutes of the October 18th, 2021 meeting. Moved by Ms. Fiacco, seconded by Mr. It's been a long day. You too. Mr. Smithers. Any discussion? All in favor?
Aye.
Opposed? Carried. We'll start off with Public Health. Director Jolene Munger. And the first resolution is setting the 2022 rates and authorizing the chair to sign contracts for early intervention services with the Public Health Department. Ms. Munger.
Hello. So this
Stand by. Motion to move it, Mr. Perkins, seconded by Mr. Smithers. Go ahead now, Jolene.
Thank you. So this is to authorize the chair to sign contracts for our early intervention services for the 2022 contracting year. There are two different rates, one for existing providers as of 2019, and then the rates changed in 2020 for any new providers. We have not had any new providers, partially due to COVID, but also due to staffing shortages in the county.
Is there any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. The next resolution is authorizing the chair to sign a contract with James McGinnis and Associates Incorporated to provide billing processing software for the preschool program in the Public Health Department. Moved by Mr. Smithers, seconded by Mr. Perkins. Go ahead, Jolene.
Thank you. So this will allow the chair to renew our contract with James McGinnis for the 2020 school year. We use their billing software for our preschool program, which has an annual revenue average of 1.7 million. And we would like to continue using them. We have been with them for the last 10 years.
Any questions or comments? Seeing none, all in favor?
Aye.
Opposed? Carried. The next resolution is authorizing the chair to sign a contract with Monroe County for morgue and laboratory services. Moved by Mr. Akers, seconded by Mr. Smithers.
This will, thank you. This will allow us to contract with Monroe County for morgue and laboratory services for the 2022 contracting year when we do not have a pathologist available.
Any discussion or comments? Seeing none, all in favor?
Aye.
Opposed? Carried. The next resolution is authorizing the chair to sign a contract with Our Lady of Lourdes Hospital and Twin Tier Pathology for morgue and laboratory services. Moved by Mr. Akers, seconded by Ms. Fiacco. Go ahead, Jolene.
Thank you. So this will allow us to also contract with Our Lady of Lourdes Hospital and Twin Tier Pathology for the 2022 contracting year when a pathologist is not available.
Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Next resolution is authorizing the chair to sign a contract with Vineski and Company for Article 6 state aid processing for the Public Health Department. Is there a motion? By Mr. Perkins, seconded by Mr. Fay. Go ahead, Jolene.
So as an Article 28 clinic, we are required to have a clinic audit. And so we contract with Dr. Ben Gruda for our audits. We are required to have 2 a year. And if they find any deficiencies, we would have to have a follow-up, which would allow for the quarterly clinic audits. So far, we have not had any deficiencies, but we do leave that in there just in case.
Thank you. Any questions or comments? Seeing none, all in favor?
Aye.
Opposed? Carried.
Point of order, I think you skipped the resolution.
Which one did I skip?
Dr. Gruda.
Ruda, okay, I'll go through that now. The next one is authorizing the chair to sign a contract with Dr. Benjamin Gruda for pharmacist services in the Public Health Department. Moved by Mr. Perkins, seconded by Mr. Akers. Go ahead, Jolene.
So then my apologies, that's the one I just did. So it's for the Article 28, with public health law, with our on-site audits that are required.
Thank you. Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. The last resolution is authorizing the chair to sign a contract with Jack Vineski, CPA and Associates, to prepare the ambulatory healthcare facility annual Medicaid, Medicare, and Article 28 cost reports for the Public Health Department for fiscal years 2022, 2023, and 2024. Moved by Mr. Smithers, seconded by Ms. Fiacco. Go ahead, Jolene.
Thank you. So Jack Vineski, CPA and Associates have been doing our audit for the last, I believe, at least 6-7 years. So this would be services for the fiscal years 2022, 2023, and 2024 for a total of $8,500 annually, and their fee has not changed, which is great for us.
Any discussion? Seeing none, all in favor?
Aye.
Opposed? Carried. Jolene, is there anything further that you would like to bring to the board?
Yes, I would just like to give everybody an update. So we have started our 5 to 11 vaccine clinics, and I want to thank everybody that helped pull our Saturday clinic together. We had participation from the local pediatricians, all of the colleges, volunteers, Board of Health members, New York State Department of Health. It was I believe it was a huge success. We ended up doing 402 individuals, which is our largest clinic to date. Of those 402, 384 were ages 5 to 11, and 13 were first doses for 12 and older. So total to date, we have done 481 5 to 11-year-olds in under a week in the county. And we started today a round of school vaccine clinics. So we're doing 20 elementary schools in 9 days to try, to try to get second doses done before all of the schools go on winter break. So we have partnered with the state and the schools for this effort. We've had one school today did 60 students at school on site. So it's turning into a really good partnership, and just wanted to let everybody know that we are attempting this endeavor wholeheartedly.
Thank you. A question from Ms. Haggard.
Hi, Jolene. My understanding is that once the 5 to 11s or even the older kids have their second shot, and 2 weeks after, if they're exposed, they can still come to school. They won't have to quarantine. Is that correct?
As long as they don't have symptoms, they can stay in school. Yes. So that is going to be the best. Yes, exactly. It's the best way for them to avoid the quarantines and get back to a normal daily school life.
Fantastic. Thank you.
Anyone else?
Good to know, my friend.
Seeing none, Jolene, thank you very much.
Thank you.
Next is Community Services with Jay Ulrich. And the first resolution is modifying the 2021 budget for Community Services for Epic Health Solutions, LLC, for improvements to billing practices. Moved by Mr. Denisha, seconded by Mr. Smithers. Jay, floor is yours.
Yep. So we're moving forward and wanting to sign a contract with Epic. Again, this will be the second time that they have been involved in our clinic services as a consultant to look into our billing practices. So in moving forward, when we do move over to take over the billing back, we'd like to enlist their consultation to make sure that we're not leaving any money on the table. It's 150 hours that we're purchasing. It's an open-ended contract, so when the hours are used up, the contract expires. The scope of work is going to involve claims reviews. We'll submit a random sample of claims that we submit to insurance companies and payers. And they're going to do things like validate the billing procedure, validate the modifiers, if there is any modifiers for extra revenue, validate the billing diagnosis codes, the rate codes, and the type of claims. So that's one piece of it. The other piece of it is training for OMH billing, training for OASIS billing, and OMH follow-up responses to questions and additional trainings, PRN. Same way with OASIS. So we're asking to be able to use the residual unrestricted DSRIP monies to pay for this contract.
Questions or comments?
There's the Zoom screen. Can you see that out there? Okay. I don't know if there was a question.
But anybody have a question or a comment? No, I don't see none. All right. Seeing none, all in favor?
Aye.
Opposed? Carried. The next resolution is authorizing the chair to modify the 2021 budget for community services for training and travel expenses and modules for the electronic health records system. Moved by Mr. Smithers, seconded by Ms. Curran. Jay, go ahead.
Yep. So this resolution is to augment. We paid them around $61,000 for the different modules that are going to be that were purchased and are being set up in the electronic health record. When they billed us for that, in the original contract, it was for 4 prescribers, which we have. And when they billed us, they only billed us for 1 prescriber. So part of those monies is to pay for that. And then there was additional expenses in travel that was not allowed by the SOAR grant that we have to pay. So again, we'd like to use the DSRIP funding to pay for this invoice that's being sent to us by the electronic health record system 1011.
Any questions or comments? Seeing none, all in favor?
Aye.
Opposed? Carried. The next resolution is authorizing the chair to sign a purchase schedule with 1011 Group for the purchase and setup of a methadone module for the opioid treatment program and modifying the 2021 budget for community services. Moved by Mr. Denisha, seconded by Mr. Akers. Go ahead, Jay.
So if approved, we would be purchasing what they call a methadone module that will be used to interface with the methadone pump. So when you dispense, it's usually you're dispensing in the morning, and so you're doing dispensing one right after another. So if we had to do this manually, we wouldn't be able to get it all done, in the morning. It also keeps track of the medication, so we can do reports out to the DEA of the amounts of methadone that's being dispensed. So it's a pretty integral part of running and operating an opioid treatment program. So this is a $25,200 for the module and for the setup. And then additionally, there is a $875 monthly fee that we will be paying them for this as well. But that's something that is not included in this resolution.
Any questions or any comments? Seeing none, all in favor?
Aye.
Opposed? Carried. The next resolution is authorizing the chair to sign a participation agreement with North Winds Integrated Health Network, IPA Incorporated, for a behavioral health care collaborative, moved by Mr. Perkins, seconded by Mr. Forsythe. Jay?
So community services remains a tier 2 participant in Northwind's IPA. So what that means is that we typically, we're not going to bear risk in a contractual arrangement with a Medicaid managed care payer. In this particular instance, Northwinds is holding the risk. So the risk is the monies have been set aside by Northwinds if in fact there's not any shared savings, but rather there's a loss because they did not meet the quality indicators. And because there's no risk to providers, tier 2 providers are allowed to participate in this contractual arrangements with Adirondack ACO, which is part of UVM. So there's really no risk to us participating in this contract. You know, there has been talk, if there is some shared savings, depending on the amount, there may be some disbursement, partial disbursement to the members, but the executive board has not yet determined that for sure. But in any event, you know, I think it's something that we've been participating in and should continue to.
Questions or comments? Mr. Akers?
Jay, the hospital up here, at least Kent Hospital, is associated with the Rochester system. How will this interface, or can you explain or talk about that for a bit? Is there no connection at all, or is it in conflict, or the services that are available that the hospital provides now locally?
I don't believe there's a conflict. I think St. Lawrence Health Systems had a chance to participate in this network of providers, but did not respond, is my understanding, but I don't know that for sure. But this is different. I mean, that's going to be a parent company that's going to, I think, oversee some of their operations, and it also has to do it with a little different configuration of their current board structure. Whereas this arrangement is separate in terms of it being an independent practice association, which they are not a member.
Okay, thank you, Jay.
Yep.
What else? Seeing none, all in favor?
Aye.
Opposed? Carried. And Jay, you have an update for us on the clinics?
I do, yes. So I guess, you know, with the no-shows, the most remarkable thing is it jumped from 12% to 16% on the mental health side, which is pretty significant increase. You know, I can't specifically speak to why that is. There was a smaller increase on the addiction side, with a total increase of, you know, about 1.6%. It did affect production. Production did trend down a little bit this month. So we're at, you know, the average clinic counselor average visits average, we were at 5.73 last month. We dropped to 5.58. When you get down to the weighted visits, on the addiction side, last month we were at 62.2. This month we're at 60.9 in terms of percent face-to-face billable hours. On the mental health side, we were at 71.5, and that dropped to 68.8. I guess what's most remarkable in terms of visits and sessions and production is that we have a new prescriber, fairly new prescriber, and last month she was at 8.14, and I anticipated that to go up because she was still learning, you know, kind of onboarding and still learning the process, and it actually went down from 8.14 to 4. So I did a little digging, and one of the reasons in terms of her no-show cancellation rate she had 43 during the month, which is pretty remarkable. And then additionally, she's able to schedule a max of 51 clients a week. And her average scheduling was 37. So, we're going to have to look at that in terms of the reasons why, because typically people don't no-show for their prescriber. If anything, they no-show more often for the counseling portion of it. So we'll have to look into that. But I just wanted to mention that. In terms of the wait list, the addiction clinics have a total of 9. Mental health total is up to 49. So that's, fairly significant as well. But we are triaging those, and there is really not very many alternatives in terms of other clinics that do not have waiting lists that they can get in, unless they're in some sort of a crisis situation, which we do monitor. The visits in July dropped again from last month. And the only explanation I can give for that is during July, when I look back at the July production handout, the CD no-show rate was it spiked. It was 17.1, and the mental health no-show rate was 16.4. So I'm assuming that kind of accounted for some of the drop in the services and individuals served. And then with the billing, we're pretty much trending the same. One thing I forgot to mention is when I go through these and I do kind of compare them to past months in terms of whether the averages are going up or down. And when I looked at October and was comparing the weighted face-to-face percentages, I realized that in the handout that you have in front of you, those are the September numbers. They were not changed. So I will have to update this to the October numbers and get that out to you.
Jay, is it the locum that has the 4.0?
No, we're no longer using a locum. We had a nurse practitioner who left for Arizona, and this person replaced that nurse practitioner.
Who does the scheduling, Jay?
It's a combination. She does some of her scheduling, but a lot of it's done, from the front desk.
Thank you.
Ms. Hager.
Thank you, Mr. Chairman. Jay, I don't know if you have any updated information about the mobile unit, but because you did tell us that it was probably going to be March, has anything changed?
Not to my knowledge, no.
Okay.
Mr. Forsythe.
Jay, you were utilizing the call reminder for an appointment. Are you still utilizing that?
The call reminder system, yes, we still have that in place.
And how many calls before an appointment?
I'm sorry?
How many calls are there before an appointment? 1, 2?
Trying to remember if it's a series. I think there's a call, and then there's either a text or an email that's also sent, is my understanding. But if that's not correct, I'll get back with you about that.
Okay, I'm just curious because a lot of times that might be a reason I would say. All right.
Anyone else? Seeing none, Jay, thank you very much.
I think I may.
Nope, he's got one.
Do you have anything else, Jay?
Well, I believe Ruth wanted me to give a little update about the electronic health record. So in terms of how that's being transitioned. So we're anticipating hopefully, February, March of trying to get the OTP operational. And when I look at the timeline that 1011 or the ECR electronic health record is giving us, they're looking at more like May. So I've been having conversations with them about fast tracking us, and I had a conversation last week, and then I also reached out to one of the supervisors today, and he says that he will help fast track that and is going to work with us on our timeline. So I'm hoping that that is not going to delay us moving forward with that project. But there's another situation that involves the security system, because we were talking with the security people that we currently have, the electronic security, and they were saying that there's a 3-4 month lag in receiving security equipment right now, much like there is with laptops and other electronic devices. So that's one thing we're going to have in place before we have the methadone. That would be a DEA requirement to have security. So I'm going to let you know.
Any questions or comments? I don't see any, Jay. Jay, thank you again.
All right, thank you.
We'll move now to Mr. Hand at Social Services for a presentation of the social services statistics.
Thank you. Dylan, are you able to share the data?
Yes, just a moment, please.
Thanks.
Yes.
You should all have hard copies on your desks.
Oh, yeah. All right.
Okay, thank you, Dylan. Looking at the social services monthly update for October, the total cases for October were up slightly from 147 last month for child protective referrals. We received 159 in October. But the total unique children associated with those referrals was down from 325 to 317. In looking at the indicated unfounded and family assessment response percentages, recently we've seen an uptick in educational neglect related referrals, which is commonly associated with an upcoming and pending holiday. So those typically are moved into the FAR area. So we'll look to see how those play out in the next couple of months. But the average indication rate for this past month was 16%. So we're hovering around the federal and state average of 15 to 16% for our indication rate. And overall, the averages remain unchanged, and it still remains 19% for indicated and 60% for total unfounded so far this year. In looking at the safety checks completed on time, we did decrease slightly from 97% in August to 91% in September. We do not have the percentages for October yet. We were able to identify that the 10 safety assessments were completed. They were submitted in the electronic record to supervision. However, due to unplanned absences, those safety assessments were not fully approved. So that's why we see the 91%. However, we've taken steps internally to address this moving forward. So hopefully we can move back up to the 97% or greater. One thing I wanted to note before moving on to the next page is that looking at the indication rates, as I previously mentioned, what we're going to be paying particular attention to is the impact of the state central registry reform on indication rates as it rolls into January of 2022. The current standard of proof for indicating or substantiating a child protective report is currently some credible evidence. However, in the fair hearing process, should someone seek to have their indication or substantiated report overturned, there remains currently a higher burden of proof, or what is known legally as a fair preponderance of the evidence. This essentially means that it is not unreasonable that a child protective case is properly indicated or substantiated at the local county level by CPS. However, many may not meet the higher necessary level of proof through the fair hearing process, resulting in a case being overturned. So the state central registry, or SCR reform, hopes to bridge that gap by moving to change the evidence needed to indicate or substantiate reports to that higher fair preponderance of the evidence. This should have an impact on the outcome through the fair hearing process as well. So we'll be keeping an eye on those legal changes as we move into the new year. Sorry, we can move on to page 2. So the average caseload in Child Protective Services has increased slightly from 24 to 26. Our staff continue to struggle with overcoming the burden of the new referrals coming in with the current workloads that have been compounded over time due to turnover and COVID-related issues. Similarly, there's an increase in the cases overall from 620 last month to 651 by the end of October. And looking at the cases by unit, I don't want to get into the weeds too much about the individual caseloads, but what I do want to say is it may look different for the number of workers in each unit. And I wanted to just share, this has a little bit to do with some of our staff moving over to Ogdensburg. It also has a little bit to do with the new staff coming into the training unit. They have to be placed within a unit. So the first 2 units that you see, it looks like there's a lot of employees in one unit and very few in the other. They actually share 2 workers. So it's difficult to, show that necessarily on paper. And one of the staff under the 4590 has moved into a different position. So everything should even out, and each unit should have about 6 to 7 workers per unit, and some 5. And moving on to the next couple of units. Again, you're seeing some of our newer employees with 0 years finishing up their training and starting to take on cases. This is part of the pool process. We did have a worker leave in October, and we were able to redistribute the cases that they were not able to close. So that was a positive for the pooling process. And we have 2 staff that completed their training in November in Child Protective Services, 1 that will complete in December and 2 that will complete in January. So in looking at our total cases closed, again, when we see an outlier such as the 19 cases closed, that typically means that we've put someone off receiving new referrals and they're being moved to a different position, and or potentially they have closed out cases because they resigned or are taking a different position. Moving on to preventive or longer term services. We'll start with looking at the number of children placed outside of the home in the care and custody of the county. We currently have 308 children in foster care. That's down 1 from last month. We have 144 children that are placed in foster home settings, 18 in institutions, 13 that are home on trial basis. The net change to children in care, we saw 11 leave foster care and 10 enter. The overall average of children in care continues to decline, even ever so slightly, as we currently sit at an average of 324 for the year compared to 326 last month. We're hoping to reverse the trend that we've experienced over the last 5 years with the increase in the number of children in care. So hopefully we'll continue to move in that downward direction. The average days children have been in care, I wanted to just mention this for a second because we have talked about trying to get clarification through the state on the reporting, their reporting versus the county totals. Unfortunately, the state was not able to clarify. The reporting time periods are slightly different for the state. Therefore, we did an internal audit with our legal department and foster care administration, and we were able to resolve and agree upon and confirm the figure of 688 days in care as an average length of stay currently. So the average number of children receiving in-home or preventive services has declined from 236 to 225 for the month of October. Another decline in the number of families receiving services. This could be related to an increase in the more complex and difficult cases moving into placement or foster care or out-of-home placement type cases, or the use of community-based services without the department's intervention, or the need for increased in-home services as children are moved from preventive services into foster care. Again, the average caseload remains steady and stable at about 12. I think it's been right around 11 for the last several months. As we look at the individual units, as new workers are taking on cases, caseload should even out and be more evenly distributed throughout the units. We have shifted 2 caseworkers into adoption positions as more children have been freed for adoption. So that has caused the shifting and changing of some of the cases around. And I'll just note in Unit 2942, some of you may have noticed that all the employees have 0 years, which means that we have an entire turnover in a unit where we have all new or newer employees with less than a year of service. So it just kind of worked out that way that one particular unit had everyone transition to different positions or resign. Moving on to home finding. So currently the Department of Social Services has 109 certified foster homes. Approximately 2/3 are kinship homes, as we look to continue to ensure we're meeting the regulatory requirements, including the family first goals. And again, you see the training periods. We have anticipating some individuals to complete training at the end of this month, and again, towards the end of December. And I believe there's also an individual or 2 in January. As previously mentioned, preventive services cases typically coincide with court orders and are extended by 6 to 12 month timeframes. So closing cases, typically you will not see that in large groupings, although there was one individual that closed 7 cases, and I believe that was someone who resigned that was able to close out some voluntary cases. In adoption activity, we saw an increase of 1 child be adopted for the month of October. So we had 2 children adopted. We have 14 currently without an adoptive resource, and an increase to 53 that are freed for adoption, which is again why I spoke of moving the 2 caseworkers specifically into the adoption area. We have 3 adoptions that are scheduled in the next couple of weeks, and hopefully more before the end of the year. And looking at our total foster care placements, the family first milestones, the goals set by the federal and state guidelines are 8% or lower for institutional rates. We remain at 4%, and 50% for those relative foster homes, and we remain at 58%. So the federal and state started providing oversight and looking at these measures in September, and St. Lawrence County continues to meet those targets. As I mentioned, St. Lawrence County currently has 109 certified foster homes. The room and board rates for those homes are categorized through a level of care determinant factors that, when present or when they do not exist, place the child in that level of care and rate of foster care room and board. OCFS has a standards of payment for foster care of children manual that describes the regulations, reporting requirements, accounting standards program implications, operational specifications, as well as budget methodology. This encompasses regulations pertaining to institutional group and foster boarding homes. So I forwarded to Ruth and Dylan a copy of the OCFS LDSS 7018 form, which is the notification of foster care level of care and room and board payment form. And it speaks to the categories and determinants for the level of payment for a foster parent. Is there any questions about?
Any questions? Mr. Akers?
Heather, could you explain for the board the difference on the adoption activity, the freed for adoption and children freed without adoptive resources? So in the green, we have 14. These are children that the court has determined that they're able to go on their own, but there's nobody willing to adopt them, or are they aged out? Could you clarify the differences between the green and the blue for us?
Sure. So the children that are freed, I'm gonna just turn my a little bit. So the children that are freed without an adoptive resource are not necessarily adolescents, not necessarily children that are moving towards an independent living goal. These can be children of any age that have that do not have an identified resource. Typically, they are children that may be in institutional placement, or children that have had multiple foster home placements that have failed and have sometimes behaviors or issues that make them a very hard to place. And the blue number is children that are free for adoption that have a pre-adoptive placement. So those children are currently in a foster home that is willing and able and ready to adopt them and their siblings if they have any.
So that in that case, in October, there's 53. What's the time period that it takes to adopt a child? I mean, there's probably no set time. Does it take years?
No, typically once the child is freed for adoption, the hope would be that that process could move rather quickly. I would certainly open up, if Mr. Button wanted to add anything from the legal side, but I would say it should be a fairly quick turnaround. It's a matter of processing, obviously, the court document.
But it looks like, there's like last month there was 40, this month there's 50, and that are ready to go. And then at the top, you see that one last month was actually adopted in September and 2 in October. Mr. Button, would you dare to address this?
I referenced in comments previously at a prior board meeting concerns regarding this process. I think Ms. Rand has identified that when you're seeing that blue line, those individuals that are freed, that have an adoptive resource, it's just incumbent upon the department at that point to prepare the materials to be sent on to the court. It's a packet, and the packet is very cumbersome. It's very time intensive, but I know that our adoptive unit has been working as quickly as they can, and we have had a running tally of about 9 to 10 adoption packets just sitting at the court for an indeterminate period of time. I know that the court has a fairly large backlog. I know the court has a significant number of cases that they deal with. In fact, I know this court in particular handles twice the amount that a typical judge would in family court. So I do understand that the court is busy, but we've got a significant number of these packets that'll sit over there for a fairly lengthy period of time. And I noticed that we were filing packets sometimes in July and August that we're just now hearing are getting scheduled onto the docket right here at the back end of the current judge's tenure. So I believe I heard earlier that we have 3 that are scheduled this month. I actually think we have 5 that are pending right now, 3 that are scheduled for this month, 2 that are scheduled right after we cross over into December. So 5 of the 9 that were pending at the time have now been scheduled in very quick succession. And I wouldn't be surprised to see the other 4 get scheduled in very quick succession. The packets are not moving as quickly on the family court end as we would like them to move.
So the bottleneck is at the court. I mean, is there anything that the legislative body here can do?
Well, I know I've mentioned this before, but this board has taken a position on a couple of things, most importantly, advocating for a second family court judge. That's been something that this board has been vocal about in successive sessions. And I believe that continuing to be vocal about that will not only help what we do at DSS, but it will also help the family court system. I know the judiciary has taken a fairly strong position about this. I know a couple of years ago, Judge Caruso from the 4th JD was advocating for an additional family court judge position to be created here.
Okay, thank you. Heather, so once a child is adopted, does that end the DSS's role, or does the DSS role continue in some capacity, oversight, or what can you tell me about that?
So once the child is adopted, the department is no longer involved.
Clear as a bell. Okay, thank you, Heather.
Yeah.
Mr. Smithers.
Yeah, Heather, Harry Smithers here. I'm sure you're aware that we've listened to a lot of complaints about DSS and Child Protective Services. And I don't know a lot about DSS, but there's an article in the Watertown paper dated November 3rd, have a couple of concerns for me. I think you addressed the first one just a few minutes ago, but I'd like to have you repeat that just to clarify. This says that resolution came in response to public scrutiny surrounding the practice of DSS employees fostering children and setting their own rate of recompense for doing so. And I believe you just said that that's the rate of recompense is set by OCFS, and you gave a copy of that too. Is that correct?
Yes, that's correct. The OCFS LDSS 7018 notification of foster care level. What that does is that gives qualifying and categories in which the children have to qualify under that normal, special, and or exceptional rate. And they have to have documentation to fall into one of those categories, and that's how the rate or new level is.
Okay, and Ruth, could you forward that on to us?
Happy to.
And one other item would be over on page 11 of this, where there's a quote from one of the speakers, Courtney Fantone, that says, when a DSS employee fosters a child, a conflict arises from that child being placed in the care of that employee's employer, and from that child's case being managed by that employee's friends and coworkers. Now, we were also listening to a letter which stated that exactly the opposite was true, that the case would not be managed by employees, friends, and coworkers, but by somebody else. Could you clarify which one of those is accurate, please?
Sure. So I'll just give you some facts, some information. So currently we have 6 employees who are foster parents for the St. Lawrence County Department of Social Services. Cumulatively, they have 10 children total. Two of those individuals work in Child Protective Services. One is fostering a relative, an out-of-county child, so not a St. Lawrence County child. We have employees in child support, employees in accounting that are foster parents, and there are mechanisms set in place so that if there is any case, regardless if it's a foster child or a CPS report or a services case, that within the connection system or the electronic system, it can be marked sensitive. There are protocols in place within the department to be able to ensure that no decisions are being made by individuals within the same unit as an individual that may be impacted. And they are not privy to or involved in any email and or discussions regarding any case decision making. I hope that answers some of your question.
Yes, it does, thank you.
Mr. Forsythe.
Thank you. Heather, you said there's 109 certified foster placement homes. Is that St. Louis County only, or is that what DSS utilized?
We have 109 certified foster homes just through St. Lawrence County Department of Social Services. Fostering Futures or Children's Home of Jefferson County has 86 certified foster homes in St. Lawrence County.
Okay, and is that average, is that lower than average, or how does that stack up with prior years? Is that, or does it stay the same?
I'm sorry, how does it stack up with other counties?
5 years ago, was there 109 certified foster homes, or was there 130?
I don't know that off the top of my head because we moved as an agency completely away from having any foster homes when we collaborated with the Children's Home of Jefferson County, and they took over our foster home certification program. So at one point, probably about 5 years ago, we had very few foster homes. So since the implementation of kinship foster homes and the move to Family First and certifying relatives, we have reinitiated our home finding program. And that's why you see 2/3 of our homes are the kinship or relative homes, because we began specializing in kinship homes.
Okay, thank you.
Anyone else? Mr. Burke?
Heather, could you tell me how many caseworkers we currently have on the Protect side?
I wrote down my totals. So I believe that we have authorization for 63 total caseworkers, 32 in services, 31 in child protective services. I believe we are 13 short of the 63, 5 in CPS, 7 in foster care preventive. So I think that would mean we have 26 in CPS currently.
If I could, we have 651 cases. I think I saw that on one of your charts.
Yes.
Is that the number that, I mean, if we were to use the state's guidelines for no more than 15, that would equal about 43, a little over 43 caseworkers. Is that, am I looking at this wrong, or is that an accurate assessment?
You're not looking at it wrong. An additional piece of information that would have to be considered would be the number of cases that are pending foreclosure with supervisors. So included in the open status would be cases that are pending to be approved for closure. So I think if you were doing a much more, precise look at the numbers, you'd have to take those into consideration as well.
Would we not also have to take into consideration the number of new employees and the length of time that it takes to get them so that they are fully functional? So that on one side, you've got the cases that are going to be closed, but on the other side, you've got a number of new employees who can't get up to speed overnight.
Yes, I think that's the roadblock that we're running into is that we have a lot of new employees, and there are certain types of cases you can't give new employees. They require specialty training. And then the individuals with more experience have higher caseloads and are, kind of burn out from some of those more difficult, complex cases. So we're kind of running into that wall. We have 3 individuals that will be done training in December, 3 in January, And we have been flexible with moving some positions into CPS that we feel are a priority. But we still remain with 13 vacancies. So I think that, that speaks volumes. That's almost 3 units. So
The state monitors how many people we have with caseloads over 15. Do you know offhand what that number is and where we stand in the state?
I do have that. I think I sent that. I would have to look it up, but I know that we're still in the very bottom of the state for number of workers with over 15 investigations. Yeah, we're still very much in the bottom.
If I could ask one more question about foster care. How are we? Do we have enough foster homes? Are we constantly searching for new foster homes? What is the status of that?
So the status of foster homes is that we absolutely do not have enough foster homes. We are what I would call saturated. That is across the board. We are finding it incredibly difficult in canvassing. You have to, as I mentioned, 2/3 of our homes are relatives. So that means that most of the time they're caring for a relative and they're not interested in taking other placements. Sometimes they are, but most of the time they're specific for that child or that group of children that they're related to. So that means that the majority of our homes aren't taking just any child that comes into care. And then Fostering Futures is seeing the same. They've seen actually, I believe, a little bit of a decrease in the number of certified homes, and everyone's full. I don't want to say everyone is full, but homes, a lot of the homes are full, and some of the more difficult children that we've had to try to find placements for, it's been incredibly difficult to try to find anything or a home within St. Lawrence County for a variety of reasons. Sometimes it's, children need to be placed in homes without animals. Children need to be replaced in homes with no other children, younger children, or there are certain things that we need to consider for safety factors that may preclude certain homes. So although all homes may not be full, they may not be able to safely foster a particular child that we're looking for. And some foster homes are specific to younger children. Some are specific to wanting to foster teenagers. So all of those things play into finding the appropriate home for a child as well.
Thank you, Heather.
Anyone else? Mr. Akers?
So Heather, you spoke of 13 vacancies. Have you been given, or has DSS been given approval to fill those vacancies?
Yes, we're, I think we're offering one this week. So hopefully that will be, one less. We just lost an individual a couple of weeks ago that hadn't even started the training process. So we kind of go one step forward, one step back. So we kind of continue to hover around that 12 or 13. Several of them are backfills.
Is it a civil service employment or a general application to apply for these? Civil service, okay. And are there numerous applicants on those lists, or is it limited?
So we had a very big group of individuals that had submitted applications for provisional positions. And then when we started going through them, some of them declined because they didn't want a provisional appointment. Some never signed up for the test, so they wouldn't be eligible to be selected. Some just opted out of an interview because maybe they had another position. One individual lived out of the county and actually got a job with another county. So there's various reasons. It seemed like we had a lot of applicants, but then when we started going through them, we didn't have as many as we had hoped.
So we have provided you with the resources. It's just we need the applicants to apply for these positions. Thank you.
Yes. Yeah.
Anyone else? Mr. Smithers?
Yeah, Heather, I have a question, if you would care to comment regarding all the criticism that's been leveled at BSS and CPS from various individuals. How would you comment about the morale over there? Would you care to comment on that? Is it difficult, or what can we do to try to work with you to have a good working relationship?
Thank you. I appreciate the question. This is a difficult job. Working in child welfare on any given day, under any circumstances, is a difficult job. We tell people when they participate in an interview with us that you're likely to hear, see things that you probably won't be able to get out of your mind. It changes you as a person. It's a very, very difficult, emotional job, and the morale is always a struggle because we deal with turnover because it is a difficult job. And whenever anyone leaves, that means the rest of the staff know that they're going to have a little bit more work on top of what they already have. So that's difficult to combat, as well as the nature of the material and just the nature of the job itself is, like I said, very mentally and emotionally draining. And as we, continue to, look for the light at the end of the tunnel, I think some workers are feeling that seeing a lot of new faces is helpful, recognizing that, we are moving forward, but also we're still hovering around the same workload numbers. So as far as ideas, I guess I would have to think about that. Maybe I would ask for feedback from the staff. Certainly they could probably speak more to what they feel would be helpful at this time.
Anyone else that hasn't spoken? Ms. Hyder?
Thank you, Mr. Chairman. Heather Margaret Haggard, is there something, I wanted to follow up on Mr. Akers' question. Is there a way that we could assist in more aggressively marketing these positions, or seeking applicants? And if so, what's your feeling on that? What should we do?
Well, my first thought is I would probably have to defer a little bit to human resources and what they may or may not already do, because I'm not completely aware of that. But I know that we have certainly 4 colleges in the area, and you have to have a 4-year degree to sit for the civil service exam. So we had at one point became involved in some of the job and career fairs through the universities, but then with COVID, things went online, and it didn't seem like students were participating as much. So any, connection with the universities to try to recruit individuals that may be interested in human services field.
Thank you. That's a great idea.
Anyone else? Please.
With regard to the monthly statistics, Heather, I have those in front of me. I can answer John's question relative to the placement. So out of 64 counties that the breakdown provided on a monthly basis, St. Lawrence County for October was at 67%, 62nd out of 64. In that case, I think they break down New York City a little bit different. The most mobility we've seen, and then for overdue investigations, many of you have seen these before. St. Lawrence comes in at 57th at 53%. And then our biggest improvement, movement all the way out of that category is the safety assessments, and St. Lawrence County comes in at 28th at 91%, as was represented in the report. So certainly the most growth we've seen this year, the most improvements been in safety assessments. In the other 2 areas, we share space not too far off with our neighbors in Essex, Oswego, Clinton, back up to that list. Jefferson, Albany, Oswego, Essex, Franklin are all 50 or below.
Questions or comments?
And I'll place that on Google Drive as well, where the others are located.
Mr. Ed, I have a question, if you can bear with me. Right now, I believe as we speak, we have in our care and custody in foster homes, 11 children. 2 of those children, and only 2 of them, are being fostered by CPS employees. Is that correct?
Yes, that's correct.
Okay, so, and one of those happens to be fostering due to a kinship, a familial relationship with the child. Is that correct?
Yes.
Okay, and the other child is on the road to adoption, I understand. What, if any, effect would a resolution from this board at this time have on either of those 2 children that were being fostered by CPS staff on that family first, that kinship placement, and on a child that is on the road to an adoptive solution?
So both of those children were placed upon birth in their current foster home placement. So essentially to remove either one of those children from their current homes, and I say homes because they've been placed there since birth, would be the equivalent to the traumatic experience that any child would go through or experience that's removed from their family when we have to do a removal.
Is there any, if I may, are there any legal impediments that would be in the way of doing that? Separating those children?
Sure. So as most of you are aware of the Family First regulations, we are required by federal and state law and have been, but even more so under Family First, to ensure that any and all children are placed with kin when possible. So we would in essence be in violation of federal and state law and regulation regarding removing the kinship placement. And regarding the other child, when a foster child remains in a foster home for a period of time, they have legal standing regarding that child. So I believe that in both of those instances, it would be a legal arbitrary decision to remove the children.
And with regard to the other 9 children that are being fostered by employees of DSS, those employees, it's my understanding, are not employed in the Child Protective Services or the prevent side of CPS. They are from a variety of different departments within the Department of Social Services. Is that correct?
So I will clarify. So the 2 that you spoke of are in Child Protective Services. We do have a staff from accounting. We have a staff member who is a support person for Children's Services and a child support worker. And we do have 1 child services worker or child, not CPS, but foster care preventive worker. But they currently actually do not have any children, so.
Does anyone else have any questions?
Give you an update to
Go ahead.
Mrs. Snyder's question. Just update on applicants from HR. The last caseworker test was given in May. So there were 26 applicants at that time, 26 approved, and 24 passed. The test was just given this last Saturday. 41 applicants and 41 were approved. They can score those exams locally. They'll be doing that in the next few days.
Great, thank you.
Any questions or comments? Mr. Aqua?
Thank you, Mr. Chairman. You missed my hand there before Ruth's information, but I was just going to ask Heather in relationship to legislator Lightfoot's question about the two children and the legal ramifications for the other 9. Do any of those under Family First legal ramifications exist with the other 9 children?
So I'm jogging my memory here, just wanting to make sure.
Or even if you could provide it at a later date would be fine.
So there is one other Family First relative placement, yes.
Thank you.
Thank you. Anybody else? Ms. Rand, thank you very much. Appreciate your time. Moving on to the, go ahead.
Oh, sorry. So I was asked to give a brief presentation on the training program. I can do that now if you'd like, or.
That would be fine.
Okay. So I would ask for Dylan's assistance again with my. So I was asked to talk a little bit about the training program for caseworkers, because often what you hear is how long it takes to get a caseworker through training. Training actually begins on day 1 for all child welfare staff. Next slide. The training begins with a simple tour of the agency, discussion of program areas, pointing out things where supervisory staff are located, individuals throughout the building. They participate in a half-day orientation with human resources. They meet with our IT staff in order to get their systems set up, such as email connections, iDrive. They do a half-day orientation in the first 5 days with staff development, going over confidentiality, organizational policies and practices. And within those first 5 days, they start local mandated trainings, including HIPAA, sex trafficking, workplace violence, etc. We also provide a 3-part session purchased through the University of Buffalo Institute on Trauma and Trauma-Informed Care that talks about organizational approaches to case practice through a trauma-informed lens. Slide 2. Continuing our mandated training experiences, weeks 2 through 4. We do online training and education, and I listed some of those there for you. But since the implementation of our training unit, our senior caseworker has been creating PowerPoint trainings and recording them, both for efficiency and consistency, and they can be used and watched by new and experienced staff that may need refreshers. Staff go out and shadow foster care, preventive, and child protective caseworkers on typical home visits. They go out initiating new CPS referrals in cases, obtain collateral information. Sometimes it's via fax, phone, in person. They attend permanency planning meetings and participate in service plan reviews and case conferences as well. They participate in a drug testing and Narcan training, and that's provided in-house to our co-location staff. They do a car seat training. We have staff that are certified in proper car seat installation, and they observe court proceedings when possible. They also complete supervised visitation education and training and third-party reviewer trainings. And they do 4 hours of in-person trainings in that 2 to 4 week time period with the senior caseworker. And I've listed some of those there for you as well. Next slide. So following or within that same month 2 to month 4, they complete the New York State Office of Children and Family Services Child Welfare Foundations and CPS response trainings. These are asynchronous and synchronous sessions, virtual classrooms approximately 6 to 7 weeks with 150 hours of web-based on-the-job and classroom participation. The Child Welfare Foundations and CPS response trainings provide a consistent and recognizable approach across New York State to introduce caseworkers to the child welfare practice model. The model of practice is designed to help new caseworkers achieve success in areas of safety, prevention, permanency, child well-being, and organizational effectiveness outcomes. These outcomes are dependent upon achievement through training of core competencies in child welfare practice. These competencies include strength-based family engagement, written and verbal communication, collaboration, interviewing skills, assessment, service planning, intervention, critical thinking, cultural competence, facilitation skills, and transitional supports. They do global assessments in the home, again, doing a lot of work in the home with experienced workers and mentors, supervising sometimes a visit for a foster child, and participating again in those service plan reviews when possible. I've listed the 8 to 12 hours of in-person trainings with the senior caseworker. I also provided a list of 2 pages of more specific trainings for you to review. I've sent those along in an email already. Next page. So as far as training, mentoring, and support in that months 4 through 12, a lot of it's done through case conferences with direct supervisors weekly or daily as needed, continued opportunities for training, support. We identify areas of needs and strengths and provide specific trainings and support and supervision based on their needs. All new employees participate in regular monthly probation meetings with their direct supervisors, the grade A and or the director of services, along with the senior training mentor. This is an opportunity for them to identify training needs that they feel that they have. We discuss strengths and also areas that need or may need improvement. They complete pre-recorded mandated trainings that are more specialty areas for further enhancing their best practice and knowledge. And I listed some of those as well as they pertain to opiate use, for example, medical issues, mood disorders, etc. And there are additional training opportunities both within and outside of the agency, the community, through the Human Services Learning Center, which is an online program in which many of our mandates and additional supplemental trainings are provided by the state. And new mandates as they are appropriate and come along. And final slide. Just wanted to give you an idea of what training hours look like. So our new caseworkers, about a year in, have about 55 to 60 training days, 115 to 120 session hours, about 230 hours of in-service training. I pulled an employee's training record who's been here about 5 years, 95 to 100 training days, 200 session hours, 500 in-service training days. And those of us that have been here 20 years or longer, 450 training days, 900 session hours, and 2,400 in-service training hours as an approximation. Is there any, I can provide additional information regarding the child welfare practice model if anyone is interested through the Office of Children and Family Services. Are there any questions regarding training?
Any questions? No questions. We thank you very much for that presentation and that information, and I'm sure it will be and is very helpful.
Thank you.
Just as a reminder, the back page, we don't spend a lot of time on it. You will see us do so in the coming months. Our eligibility numbers are kept there for you with temporary assistance, supplemental nutritional assistance program, Medicaid and HEAP are reported out there, as well as safety net. So those are there if you have any questions. And again, if you'd like additional information or you're hearing other pieces of reporting that you'd like to see, please let us know. We'll continue working on that.
Mr. Smithers.
We talked about the need for a HEAP program. How do our numbers this year or currently recently compared to prior years? Do you have
So on your back page there, you've got at least the last 3 years. The blue is 2019. So you can measure, we kind of do month to month, but 3-year differences. And we can look at a group of that and get that for you.
So they're actually down.
Yes, yes, so far. And they're just ramping up for the season now. We are, I believe, 2 staff shy of being fully staffed. With the heat staff, we have a couple staff who stay year-round, who they're also dealing with the heat cooling component, which is not as popular as our heating assistants. But they are year-round. The rest are brought in seasonally, and they're here on a temporary basis. So those folks process applications and things like that.
What else?
Mr. Denish, is Heather still with us?
I believe.
Yes.
Heather, Larry Denisha, I have a question regarding heat. How can a person that's receiving heat benefits end up with an $800 credit in fall?
What? So your question is, how can someone who's receiving heat benefits have $800 credit, correct?
Yes.
Okay, so I would probably be most comfortable with referring that question back to our HEAP department, and just making sure that I'm giving you the most accurate and best answer possible. I think I know the answer, but I don't want to assume anything.
Okay, that would be fine.
You bring that next week.
Okay, thank you.
Yep.
What else? I think that's it.
I think so.
Thank you again. We'll go to the vacancy review committee.
Yes, sir.
Mrs. Doyle.
We have 2 departments on this committee agenda. The first is community services, and the second is social services. Jay?
Okay, thank you. So this first vacancy authorization is requesting a fill of a behavioral health counselor. That could be either a CSW or an LMSW or an LMHC. And this position was vacated because they were promoted. This person was promoted to a program director. So as program director, she might carry 10 or so cases, unlike a full-time behavioral health clinician would probably have anywhere from 80 to 100. So given that we do have a waiting list, and we're trying to manage this caseload at the same time, I would ask for an immediate fill.
Questions for Jay? Okay, next one.
The next one is this Secretary 1 position in special programs is now vacant or soon to be vacant due to a retirement. With the exception of the IDP instructors, this is pretty much a 3-person program, one being the traffic safety specialist, one being the program coordinator, and the other the secretary. So the secretary in this position, they scheduled for the IDP classes, they keep track of attendance fees and paperwork, etc. They take initial calls for the interlock device. They are also sometimes present, the only person present when someone comes in to look at the materials for the victim impact program. Oftentimes the program coordinator and the traffic safety specialist may be out of the office. So if there was not a person in this position, then there would be no one there to respond to walk-ins or phone calls. So again, I'm asking for an immediate fill for this.
Questions for Jay on the secretary? Okay, and last one, Jay, supervising social worker.
Yeah, the supervising social worker position is a fairly unique position. This person is resigning from this position. She has quite a few years in the county. She's come and gone a few times, but anyway, she's been there at least for the past 5 years, contiguously. And her role is this person would carry like 80% of a regular caseload, and then the rest of the time would be for some minor administrative duties, but predominantly providing clinical supervision to the social workers within the department, the social work / clinicians. And again, for the same reason, because of the wait list, and trying to manage this, soon to try to manage this position. If it's not immediately filled, it would certainly be difficult.
Questions for Jay? Okay, thank you, Jay.
All right, thank you.
And Social Services has one clerk position to speak to you about this evening. Heather?
Thank you. So this position is needed and necessary for the department, as we see over 700 clients approximately a month at the front desk, average almost 6,000 phone calls per month. And this individual divides duties with other clerks throughout the building to assist in imaging, filing, and delivering mail. This particular resignation was a result of the employee's family relocating to the Albany area. So this individual resigned to move with their family.
Questions?
Mr. Forsythe.
Thank you. Bruce, I guess it's for you.
Okay.
Social services clerk as opposed to a community services secretary. Look at job descriptions, they're similar. Quite similar, I guess. But the salaries are different. The community service secretary one is about 20% higher start. How are those determined?
So civil service classification based upon duties. And what you also see there underneath the base salary is the grade. The clerk is a 13. So one, you have lower requirements to qualify, to sit for the exam, and then be placed on the list. Secretary one is a grade 20, so higher qualifications to sit for the exam. And then also higher level of duties that are probably the type of work here is more generalized than it is specific, but really limitations on sort of the ceiling of duties they can carry out.
When I just looked at it.
Quickly. Similar function, right?
Yeah.
Any other questions? Okay, thank you, Heather.
Well, we'll move now into the entitled budget review.
Good. All right. So Dylan will take the screen for those of you joining us by Zoom. I think we adjusted the colors a little bit. Hopefully that's easier on the eyes here. In each of the jurisdictional committee meetings this month, I am bringing you about 9 or 10 slides, so if you'll indulge me. Trying to stay on point. I've expanded a little bit more in depth with the departments here for very obvious reasons. One is public health, and we've been living with COVID for 2 years. The other is social services, and certainly explanation there as well. So those are 2 areas I'll go a little bit more in depth with, but I did, just like I did last time, want to do a little bit more global to start out. So as you know, I am focused on the, next slide. I am focused on the reinvest, refocus, and redefine as the theme this year. And this meeting, I've kind of gone out of order. So in the recover portion, I'll talk about that when we discuss COVID. But I'm going to start with equalization rates. So as you know, the way the distribution occurs of the levy for our residents is based in part on the equalization rates. So I just wanted to take a moment, and most importantly probably as a percentage. So these are in billions. This is the equalization rates for the county full market value. So you can see for 10 years, starting in 2010, we hit the 5 billion number. And not until 2020 did we hit 6 billion. So what I'd like to do when I've got time is take a look at how that compares around the state to, or even the region, to what you're seeing in terms of increase in assessed valuation. So what that does, in some years you can see in 9 and 10, and then again in 19 and 20, you've had some bolstering of that percent change. You've had some revaluations, you've had a number of activities that can influence that. But keep in mind, you also have some challenges to assessments and some reductions. So those are always working for and against us. So in keeping that in mind, you saw in 2020, there was a nice, in 19 even, there was a nice percentage there of 3, 4, and then 3. This year, we're down under 2. So when you look at overall, we always used to feel good if we were over 1. You can see why. Those couple of years where we've boosted well above, that's helped us, because when the levy stays behind the valuation, you're able to lower taxes, even if you have to have a slight increase in your levy. So this year, I'm really proud, the budget team's really proud of not only a reduced tax rate by 17 cents, but also a reduction in the levy by 67,000. You don't often get to do both. So the overall average change is 116 million. And as you can see in 2018, it was barely anything. And then our high was certainly in 2010 with that 6.89%. So sort of all over the map, but we spent about 10 years in that 5 billion range. Next slide. And that's just over that 2%. So then we talk about reinvesting. And I wanted to lay out for you what the levies look like in that same period of time. Part of what I'm very proud of is when you look at the right-hand column, since 2016, which was my first budget, you see a lot of zeros as far as the levy change. The last couple of years, you see a little over 2%, but that's very helpful in my mind when we still stayed with that valuation in the 47, 49, and now we're at the 50 million as far as the levy is concerned. So for many years, you see, if you go back, lots of talk occurred back in 2013 and 14 when we had to ask for the additional 1%. So you saw that 14% increase. And the following year, you saw not quite the 14.42, but a reduction of equal proportion when that sales tax percentage came in. So it was given right back the following year and replaced with a tax everyone considered equal for all rather than just property tax owners or property homeowners. So then you look from 16, actually 15, all the way through to 2020, the levy stayed within $1 million. For 14 years, we stayed in a percentage of only 7 times appropriating fund balance. And as you all know, for a few years there, we didn't have any, so we certainly couldn't appropriate it. However, coming into 2012, there was a modest appropriation on an average of about 2.3 million. And over the last 3 years, and those are the asterisks that you can see, the last 3 years, in rebuilding our fund balance, in returning to fiscal health, we believe it's responsible to appropriate fund balance, to demonstrate that you do contribute savings to reduce that overall levy, but also to demonstrate that in the following year, you'll see a return to those savings as well. So looking at if the tentative budget moves forward as presented, with approximately 250,000 appropriated from the highway fund balance, we have a negative 0.13 reduction in the levy. Next slide. So then when we talk about reinvesting, we look a little bit more at our needs and services. I just mentioned a few here, but as you know, we've seen a tremendous increase in some areas that require attention. Certainly throughout COVID, we've had some extra spending internal to county government, but also in some of the needs around the state. There's been the PPP funding. There's been a number of ways that the state and the federal government have attempted to assist areas of need during COVID. Obviously, we spend a lot of time talking about children in care and what those numbers have been doing, but also approximately 40% increase in our home delivered meal need. Now, as you will remember, we had to close our congregate meal sites, so that prevented some folks from coming in to dine, not only impacting the socialization, but to make sure their nutrition was passed along. And that has required additional, not only expenses associated with the food, but also the volunteers. A great need remains, as Legislator Denisha likes to remind us, a great need exists in home delivered meals. So if you know anyone, if there is anyone that's available, they can work with you to get a route that will be helpful to folks in need of home delivered meals. Heat, as we talked a little bit about, there's always an increased need there. We have seen some numbers. We're just getting up to speed, so we'll watch those this winter. But I would say also then mental health services, you've seen just about since August, before that it was in the 20s, but you've seen just in our clinics an increased need that's hovered right around the 40 to 50 range for folks on our waiting list. So again, that's a big area of need. The schools certainly are seeing it, and they have increased their support staff from counseling to all different types of infrastructure supports to assist students. And that certainly extends beyond the school day, the school district. It goes into the homes. And our family, children and family support team is working. We've had some transitions there with staff, but they're also working to assist. Next slide. So much like I did with the reinvesting of departments, the cost and change in dollars attached to all of the departments that you're seeing here, modest increase in most of them with the exception of social services, tied to certainly the positions, but also some shifts in our institution and institution board costs, which I'll go over a little bit later. So they saw an 11%. A lot of funding in the federal and state level has come in for Office for the Aging, so those numbers have been improved. As far as being able to bring grant funds in, they're pushing right into the community. Not a huge, and I'll go over that as well, not a huge increase in their direct cost to the county. Veterans, weights and measures, and Youth Bureau hover right around anywhere between 1 to 10%. So they're well below, as well as public health. And I'll spend a little more time on them as well. Next slide. Again, reinvesting, now we'll take a look at the personnel changes. Social services, much like the sheriff did last week, social services leaps off the map too with 23.6 FTEs. And remember, that's not necessarily a full-time person, that is hours attached to folks in the department. But as you know, 20 of those positions, so by far the majority, are in children's services. We did, and I appreciate the approval of the vacancy resolution last month, which provided a little bit more latitude for me to, again, work with them to bring folks in and to continue trying to get those needs met. No change in veterans' weights and measures. A modest change in the allocation of a clerical position in Youth Bureau. You're seeing a modest increase in Office for the Aging. We have added 4 in public health. You heard from Jolene tonight, and it's the same that you'll hear probably next month as well as you heard last month. They have positions open. They're working hard to get people to take them. That's the challenge. And community services modestly up just over 1.35 FTEs. So there has been an add in areas where, as I talked last slide about, where the needs have pronounced themselves during COVID and otherwise. Next one. So now I wanted to just take a couple of minutes to talk about county-wide expenses attached to COVID, and then I wanted to spend a moment on public health. So as you can see, and this one I apologize isn't as great as I hoped from a color perspective. The total across the bottom there, just under $500,000 at 434. We have not had equipment-based for the grants this year. The personnel that you're seeing there is either extra hours, temporary positions that I share with you on occasion of bringing folks in. Remember, they're 3 months or less. Some are moving directly into permanent positions, but those are the expenses we're working to capture for FEMA reimbursement where they qualify, and then expense the grant-based funds. As you can see at the top, they're not yet fully reimbursed. So overall for this year, and we're working, I'll get you a total on what 2020 looked like. We're looking at about 434,000 right now. So then subset of that is the next slide with public health. And that is certainly under the recover with regards to really giving them the resources that they need to do the job. And that is approximately 237,000. Again, same idea with the personnel, that's extra hours, that's temporary positions. Looking at the revenue attached to that, again, not yet fully reimbursed, but some grant funding has come in. As you know, they've received large funds from the state on the state or the school district testing. And so we are ordering and sharing and making all of that available. As you also heard, Jolene's got staff working to get all the vaccinations done in a remarkable 10 days, as well as having a greatly successful clinic this last weekend. But as you can see, the benefits also is a fair amount of the grant funds included at this time. So next I wanted to break down for you is, as we've been focusing on also, redefining county government. And in these areas, looking at the 22 budget, I'll do this for public health and for social services. So in the front page of your department books, you'll see a chart that looks very similar to this. It breaks down for you the categories. So we try to keep it high level so you can keep your mind wrapped around the 14% increase in personnel costs in public health. That is for positions, but also additional temporary folks as well. It's a decrease of 11% in the contractuals, and that speaks to a real decrease in looking at our preschool transportation and our preschool tuition. So you don't have to be involved with county budgets for very long to know how challenging preschool is and how many times we've asked the state to assume this responsibility. It really isn't a function we provide, it's a pass-through that we pay. So often we've asked for a seat at the table for a variety of reasons between the way services are delivered and our ability to pay. They keep them very separate. But that being said, we've had a tremendous challenge for transportation. Jolene is working directly with the school districts, knowing that our provider is no longer going to be an option for us next year. We're working through what the increase was associated with that, as well as the contract indicator of that being that COVID shut down and challenged our ability to budget for that. So we currently have 154 children. In the summertime, it was around 200. So we're seeing quite an ebb and flow associated with children who are receiving these services. So that for next year, in this year's budget, that was for special travel was 1.25. That's reduced to $1 million for next year. And our tuition and payment was budgeted at $2 million for this year. We're reducing that to 1.7, both with the reduction in numbers, but also working directly with the districts. Our hope is that there won't be as great an expense when they're working inside district lines across the county. So when we looked at 2020, I believe you had a budget mod that increased the availability for that, and they had projected 710,000 in 20, came in around 400. As you know, 3/4 of 2020 was COVID related. Also with tuition and board, they had projected 2 million and they came in at 1.5. So again, very difficult to find normal when it comes to COVID and working with schools on the preschool component. So any questions on public health right now before I move on to social services? That really is the global view, and an increase overall of just 3.8%.
I have just one quick question.
Sure.
You're talking about reimbursable or FEMA reimbursable. The two Rheonics testing machines that we bought, $50,000 a piece, are they reimbursable?
I believe that they are, but I'm not sure if that's through a grant or through FEMA. I'll find out. Yep. Other questions on public health? Okay. Moving on to redefine and seeing some of our conversations around social services, now onto the finances. You're seeing an 11% overall increase in costs in social services. And that, for a number of years, we focused on a few areas. Certainly, I typically yield in terms of having a commissioner in place, but I will do my best and take any of your questions or concerns back and get you additional information. But overall, I think we're all aware, I mentioned earlier, the staff increase. That is a total of 1.4 million with benefits of 1.2. So we're looking at quite an increase of 29% in people, which we all know is reimbursable, as well as their benefits, but that's a 50% increase in the fringe associated with the folks that have been added. When we look at the overall total in revenue attached to that is another $1 million. So it's not as though those positions come wholesale to the county cost. So that's typically one area. When we look at revenues coming in, our federal revenue is up 4%, our state revenue is up 6%, for an overall increase in revenue with other sources included of 8%, while expenses are up 10%. So we're seeing that increased cost. As you know, if we were to look at without any aid, we're up in the 70s. 70 million for social services costs, by far our most expensive department and our largest from a human resource perspective. So looking at all of that, we are outpacing a little bit. However, the funds attached to that, also typically we spend some time talking about childcare institutions and institution board. And so looking a little bit more at that, we're seeing there's two lines in your budget. If you take a look as far as institutions go, we have seen in one a $900,000 increase coming from budget in 21 to budget in 22. And those are related to CSE. So those are children not in our care. However, they are institutionalized and require us to make those payments. The children in our care in the institution and board cost is up 1.5 million for a total of 2.4 million increase. However, as mentioned with personnel, we're also seeing a 1.1 increase in federal revenue attached to the FFS funding. So as many in the past have talked, I think from a financial perspective of the constantly changing pots of money associated with social services. So for example, with bail reform, we've seen a reduction in the JV and PINS funding. We've seen a decrease in those lines from 213,000 down to 15. So $198,000 decrease, so that's great. We've also seen that a reduction in our revenue from 700,000 to 300,000. But those funds aren't necessarily lost to the county, they're moved to a different pot and made available as part of that 1 million that I just mentioned. So wildly challenging and complex budget, but those are some areas typically that we spend some time talking about and that carry some significant price tags. So when we talk about Medicaid, that's the other area we usually spend some time talking about. We've been fortunate to receive word that we have a reduction in our weekly share from, I believe, end of October through the end of March, so until the end of the budget year, of $44,117. What that will equate to is about $350,000. And so we're also projecting that we'll come in with a budget of about 21.5, we'll come in about 20.1. So again, a slight reduction doesn't mean it won't be reappropriated. And as you will recall, the resolution not that long ago reappropriated some funds within their budget. We always like if they can find those appropriations before they have to come to contingency or to fund balance. So from that perspective, being able to fund some of their areas of significant increase, we're certainly appreciative of them doing that. You may see again by the end of the year, another appropriation shift to where there's increased cost. But having a reduction in this area is certainly helpful to the county. As we currently believe, our cap remains in place. There often is a push to remove the cap and allow those costs to increase beyond what we can afford. This is, if you think about it, if we're talking about 20 million of your $50 million levy, that's local share. That's a remarkable number. In COVID expenses underneath, we talked about a reduction in the expense of equipment. As you'll remember, at the beginning of 2020, we sent everyone home, bought some laptops. That's just an area I also forgot to mention during COVID. But those are the main areas of social services. I certainly am open to questions on that. So overall, as you can see, an 11% increase. As you look through your budget, this is not an anomaly when you look across the benefits line. So in that area, I did want to mention to you, you see a 31% here, so $1.9 million increase. And when you're looking across at the other departments in this area, you will see an increase that actually, in some cases, brings them almost flat. So this slide, you can go to the next slide. In redefining, just to give the other departments on services a little airtime, Office for the Aging is flat. It looks like 21% increase, but the benefits are 20% of that. So that's what you're going to see across here on social services. You just saw 31%. We're seeing, and I'll go over that at finance, we're seeing increases in our healthcare and the costs associated with that. We're also trying to catch up where we can, those costs going out to departments so that they can claim revenue against that. In community services, they are $328 different than this year's budget. Pretty remarkable. 0.02% change. And again, when you look at the budget breakdown, you'll see a 29% change in benefits. But they've been able to increase their revenue to cover some of that. Veterans is at 1.59%. And in veterans budget, just to keep on pace with that, it's $2,000. Pretty remarkable again. And in weights and measures, $12,000 different. 10% in their $100,000 budget, and 20% of that is benefits as well. So your departments are managing their budgets. That's the message. And in Youth Bureau, don't want to leave them out. Benefits are 43% of their $13,000 change. And again, just trying to point out that's really carrying the weight of a lot of your department changes, where they manage their contractuals, where they're managing their people, even with the flexibility you've given with some temporary positions, so if the seat's not left cold for very long, or bringing in additional folks where needed. You've been very generous, and they're still managing their budget. So I want you to be aware of that as you look through these, and certainly send us your questions. Are there any questions on social services or any of the ones that I laid out for you here?
Of course, there's just one thing. When you show the first slide of the tax levy and the decrease and whatever, I think a fair synopsis would be to add sales tax for those 10 years or 20 years, just to show how that has helped perform and help to offset.
Absolutely.
Absolutely. The other thing I keep thinking, we hear a lot about inflation lately, price of gas, price of heating oil. But for local government, it's a good thing, right? Sales tax revenue is gonna be up, and if sales tax trends, I have to refer to Dan in this, but shouldn't that lead to a good thing for local government?
Potentially. Personally, for our pocketbooks, right? But professionally.
People may use less,
Can you
but,
bring that slide up?
Yeah.
but yeah, I think sales tax should be equated.
So, and I think if you look here in 13-14, you see that as far as the levy goes, we went up to 53. And like, to your point, we were able to come back down into the 40s and stay there for a number of years.
What year did sales tax outperform property tax?
I will get that for you.
But it's 2013. It seems like it was in the low 40s. I remember.
Yes, I will get that for you. And I think also, if you go back, Dylan, on equalization rates or assessed valuations. So when you look here and you see the flat amount, you also were having a pretty constant turnover of evaluation. Roughly between 3 and 4, sometimes 2, but I believe 4 was the max in any given year that you were seeing evaluations occur, and that certainly helps. The challenges that we have that reduce those overall assessments is of concern, and Legislator Burke has raised that a number of times as well. Okay, any other questions? Concerns? My hope next week is to bring you the departments attached to finance and then answer any remaining questions, bring you back the questions you posed tonight, and be able to hopefully wrap up our discussion so that we can have a public hearing on December 6th. That is also the evening you'll have a public hearing on the reapportionment of the districts. And so we would stagger those, one at 5:40, one at 5:50, before you would be requested in the regular session to approve and adopt the 2022 budget. Any questions about that? Okay. Next up is me.
It's you again?
I just have a couple of things for you on county administrator's report. Just want to give you those percentages. I know many of you take back to your town board and village board meetings the overall percentages. Fully vaccinated, I think you heard Jolene say 55.5%. In the 12 to 17 is 67.1. These stats are on the first vaccine. For these next ones, fully vaccinated was the 55. 18 to 64 is 68.1. And remarkably, we continue with the 65 plus population at 87.6. So that certainly is our most vulnerable and certainly our by far highest percentage of vaccinated folks. So those areas, just to keep you current, as we mentioned, successful event. Also, if you would indulge me, I'd like to have Steve speak to the OSHA requirement that would see all employers over 100 have to mandate vaccine or test weekly. And just to keep you on track with where we understand things to be at the moment, if you wouldn't mind and the chair would indulge.
Would you like me to speak from here, or would you like me to come up?
Wherever you are.
I can speak from here. I know there's been a lot of questions that have been sort of circulating around as to what the status of the current vaccine mandate is. I know a lot of folks are aware that on November 5th, OSHA actually released a directive to employers of 100 or more employees that they employ a vaccine mandate, that vaccine mandate going hot on January 4th of 2022. On the date after that was announced, that temporary rule or emergency rule was announced, there was a filing that was made down in Louisiana challenging that in federal district court. Temporary stay was enacted at that time. That was November 6th. A 3-judge panel of the 5th Circuit this past weekend was able to review that. And they not only kept it in place, but they announced a much stronger position on it, believing that the individuals that had filed the suit against the OSHA enactment were likely to prevail on the merits associated with their suit, and extended the stay with respect to that. I'll also note that here in New York State, there are several litigants who have now filed for Supreme Court review of their own denial of the application of the religious exemption associated with the vaccine mandate that was here. The Supreme Court has not taken that up. That's the United States Supreme Court, not the New York State Supreme Courts that we have in the various counties. But I do anticipate that that is likely to be visited by the Supreme Court. If you'll recall, about a month ago, the state of Maine had a similar case The state of Maine had employed a vaccine mandate that did not provide for a religious exemption. When that went to the United States Supreme Court, the United States Supreme Court declined review on that action. But what they did was left a serious amount of confusion due to the varying decisions that were out there in the various circuits that were available. Obviously, the Fifth Circuit's decision is raising serious questions as to the applicability of vaccine mandates on governmental entities, on employers. As it stands right now, the Fifth Circuit stay is a nationwide stay of enforcement of the OSHA regulation. It's not only applicable to the Fifth Circuit and those states that are found within the Fifth Circuit, but it does apply nationwide to OSHA. Obviously having an impact on New York State. And like I said, with the application to the United States Supreme Court by litigants associated with a religious exemption for the vaccine mandate in New York State, that too is likely to have an impact on us should the United States Supreme Court take up that issue.
Questions? And I will be talking with you more about that as it continues to unfold.
I would have asked briefly about this. In the students that are in school, you sent us a notification that you had a good day Saturday with the number of vaccinations. Do we have any information on countywide, how many school-aged children are getting vaccinated? Because this does have an effect on the number of quarantines. I hear there's quite a number in Governor right now. It would be certainly encouraging, I think, for students to get vaccinated so they don't have to be quarantined. So do you have any statistics on how many school-aged children have been vaccinated?
Well, I think probably a better time to review that would be after these 9 days, when they are, they had 60 at one school, I think today, and another 40. And they have filled up many of the school announcements are now, those online registrations are full. So certainly there might be a no-show, there might be a quarantine, there might be a number of things. So if it's okay, I'd like to bring that to you at the board meeting and at least give you the 400 we had, or the 384, as Jolene mentioned, and then how many we see at each of the school districts. I think it would be helpful, certainly overall, last year when we did the mask campaign, we had a number of around 16,000, 16,500 of total students, and that would certainly include some probably that are 17, 18, in the higher, K-12 age range. So looking at those overall totals, we can get you those numbers once we make this pass and then see, what we're left with. John, that's a question.
Mr. Manoli.
Are we able to gather the data once they start vaccinations at the pharmacies as well? Are we able to gather those numbers from the pharmacies?
Jolene, are you with us?
I am.
Can you speak to how the pharmacy data comes through?
I wish, normally I can. I tried pulling that for tonight and I had to contact the state system NICES. Unfortunately, the ad hoc report is broken statewide, so everything is getting there and reporting out. I just can't pull a report on it. I did try. I know Walgreens has done at least 25 because they're showing in the report, but it's, I will be checking it on a regular basis and I can give Ruth an update to share with everybody as soon as that report is fixed. But we have done 481, about 17 of the ones we did are not in county. And then we have 40 some registered for tomorrow and close to 80 for Wednesday, just ourselves. And we do have some private practices that are also administering it.
Good. Thank you, Jolene.
You're welcome.
Just a couple of other items before we move on to committee reports. Wanted to let you know, I shared with department heads that going forward, any of their audits, federal, state, or any other funding agency should be shared so that we can share that information with you. And to that end, social services is nearing completion of a federal audit on the recertification of benefits associated with the Supplemental Nutrition Assistance Program, otherwise known as SNAP. And when that information is provided to us and we have an update, we'll provide that to you, and if we can, have a short synopsis provided to you on the outcome. Also, I wanted to mention negotiations will resume once again with the Deputy Sheriff's Association later this week. And finally, the Bonadillo Group made it on site last week They spent one afternoon and part of the morning here in Canton, and they spent part of the remainder of the morning in Ogdensburg, meeting, going through introductions, answering initial questions. They now are planning with our staff for case review, access, as well as scheduling time on site. So we'll keep you posted each month as services, but also any information in between that needs to be provided. Questions?
Mr. Arqua.
Thank you, Mr. Chairman. Ruth, what's the expected longevity of that investigation?
So we have acquired their services for 6 months.
Thank you.
And each month I'll provide an update, and every 2 months they'll give us a written report. Any other questions? Okay.
Awesome. We'll move to committee reports. The Board of Health, Mr. Akers.
Mr. Chairman, we will be meeting tomorrow night at 6 o'clock
Mr. Sheridan.
on Zoom.
Mr. Sheridan, the CDP Board of Directors.
Yes, Mr. Chairman, the St. Lawrence County Development Program Board of Directors met today. And are you able to hear me?
Yes. Yes.
Okay. The Head Start is currently running within the budget at 69.11% expended. And after taking into consideration all the reported expenses for future expenses, they are looking at a little over $200,000 that they'll need to be spent. That they are there's a proposal that they're working on to purchase 2 new buses, 2 new cars. Head Start is working on a plan to spend the rest of the money, so there's no concerns there. The Head Start training program grant is 54.8% expended, with approximately $17,940 left to spend. The money has to be spent by the end of the year. There are no concerns that this grant will be fully expended by then. And the Head Start ARP grant is 41% expended. These funds have so far been utilized to purchase 2 buses, 2 Equinoxes. And they are recorded as assets and therefore not reflected in the expense. So there is approximately $228,000 left to spend through December 22. And weatherization-based grant is 47% expended. Fee for the service van will not pass inspection because of the condition, and they will be looking into funding options to replace the van. And the weatherization, health and safety showing a $12,725 showing that in expenses. And this will slowly increase as the units are completed. Heat was just getting started for the season, and there's not a lot of activity yet, but that's expected to increase. They did have some discussion. There was some discussion about how much food the Ogdensburg Correctional Facility donates to our agency and how the closing will affect CDP. That's it, Mr. Chairman.
Any questions? Seeing none, thank you, Mr. Sheridan. Ms. Curran, Community Services Board.
Good evening, thank you. Jay had an update about the OTP and the fact that we passed a resolution to approve the funds used for that. Construction will begin soon. The special programs will be relocated for a clear patient flow. They also talked about the forensic state aid was increased from $60,000 per year to $160,000 for the mandated MAT project with the correction. The Community Service Board approval was needed for the Cherry Street 5-bed facility. There's also a United Helpers facility on McIntyre Road that they discussed. The proposal was to close the Cherry Street and McIntyre and to renovate Irish Settlement Road into 2 6-bed facilities. And then the overall loss would be 6 beds in that area of the United Helpers. That was really kind of it. There wasn't a lot this month. And the next meeting is the first Tuesday of December.
Any questions or comments? Seeing none, Mr. Denisha, the Office for the Aging Advisory Board.
Mr. Chairman, we met on Monday, November 8th, via Zoom. Really wasn't a lot to report. Next meeting is Monday, February 7th at 10 a.m. But the one thing I do want to mention is that the holiday gift drive for older adults is on. It's the 8th annual holiday gift drive, and the Office for the Aging is requesting donations, monetary donations for the purchase of gifts, gift cards, baskets for folks on the home delivery meal route. So they and I would really appreciate your support.
Any questions? Seeing none, the Youth Advisory Board, Ms. Terminelli.
I believe Ms.
Oh, you've got a question?
I'm sorry.
Oh, I'm sorry.
I was late. That's okay. If I may direct my question to Mr. Denisha, how do people, do they go online or is there some way to mail in those?
Yeah, actually, Margaret, folks can call the Office for the Aging at 386-4730, or they can mail their contributions directly to the Office for the Aging at 80 State Highway 310, Suite 7.
Thank you.
You're welcome. Thank you.
Anyone else? Ms. Terminelli,
Thank you.
Youth Advisory Board.
Yes, sir. Our last meeting was on October 28th, and some of the high points from that were that the 2022-2024 Youth Development Programs, their committee went through the process and 14 applications were all approved for their funding for a total of $106,456. We have a Teen Talk a Teen Virtual Leadership Summit coming up on Tuesday, November 30th from 7 until 8:30, and it's being hosted by JC Cole. And Colton Pierpont is actually having a viewing party, so they've one of their classrooms so that kiddos can come in, especially kids that don't have accessibility, can come into the school and watch it from there. And the Youth Bureau is continuing to work with county schools to see if they can have a similar setup in some of the other schools. The focus for the Leadership Summit will be social, emotional health and well-being, as well as student leadership and how to find student leaders to support their peers. The Suicide Awareness Walk wrapped up at the end of October, and it was 1.2 million steps for a total of 500 miles. So thank you to all that participated in that virtual event. And then finally, a press release went out. We are looking for members for the Youth Bureau, or the Youth Advisory Board, is looking for members. I believe we have 4 openings right now, as well as the Youth Committee. We would like to see representation of at least 1 high school student per school district so that we have representation across the county on the Youth Committee part as they continue to develop programming to meet the needs of our area youth. The next meeting is the 17th for the Youth Committee at 4. So any teens that are interested could join that. And then the 18th at 3 o'clock for the Youth Advisory Board.
Questions or comments? Ms. Hager.
Thank you. If I may direct my question to Ms. Terminelli, how are you advertising for these kids from each school to join? Is there a poster or?
So there is, and I can forward it, yes, on the Facebook page, there's a poster, but there was also a press release that went out that had that poster information in it as well. Just like any of the other committees for the county, they fill out that bio data sheet, and then they would come through as our normal approval does for committee appointments.
Thank you.
Yes, but we could definitely forward it out, possibly through the BOCES to all of the districts at the superintendent meeting, so that we could try to get those.
Great. Thank you.
Yes, absolutely.
Anyone else? Seeing none, we'll move on to old or new business. We have a resolution on the table concerning the placement of children that if it's going to be discussed at this meeting, it will need a motion to remove it. Is there a motion?
Mr. Chairman, I would move that we take this off the table and address this tonight.
Mr. President.
I'll second.
Is there any discussion on Mr. Akers' motion? Seeing none, all in favor?
Aye.
Any opposed? Mr. Arquette is opposed, and Mr. Perkins is opposed.
I'm gonna oppose those.
You're going, and Mr. Smithers. Mr. Akers.
So I'd like to address the resolution that's now on the table.
Well, wait a minute.
Okay.
We just voted not to take it off the table, so I think it would be inappropriate if we started discussing it.
So
We removed it.
It's removed. Yes.
it's on the table. So it's been removed from off the table, now it's in front of us. So I would like to address the resolution in front of us that's on there. I feel, initially I felt like with the Bonadillo group that we needed to wait for further investigation. But I really, after tonight's discussion and presentation from Heather Rand, I don't feel that there's any need to prolong the uncertainty. It's clear tonight that, based on our discussion with social services, that with 109 foster homes, that we don't have enough homes. It's also clear that we have 6 employees that amount to 10 children, and that 2 of those are actually, I believe, in kinship. And actually 2 of those individuals, those children are actually placed with these individuals from their day of birth. And I am not actually interested in actually having a resolution that would take these children away from those individuals. For all intents and purposes, these are their parents. And for those reasons, I will be voting against the resolution of establishing a foster care resource while seizing the placement of children in foster care owned and operated by employees of our DSS. I think that we would be limiting ourselves, and it seems to me that the type of oversight that's being provided by DSS as far as the care of these children, that these employees themselves are not wadding their wallet, so to speak. And so I would vote in opposition of the resolution.
Mr. Forsythe?
I'd like to echo pretty much the whole last statement. If anything, we need more foster homes, not less. I believe the oversight's there. We have a very good county attorney that's swung over there to watch the legal aspects of this, and I agree with Mr. Akers on this.
Ms. Hager?
Thank you, Mr. Chair. Through the questioning that went on of Ms. Rand this evening, I thought she did an excellent job of giving us the facts about this situation. I agree with Legislator Akers and Forsythe. This is something we need, and these are kinship situations, so I will not be voting for the resolution.
Mr. Smithers?
I agree. And the information that we get from the Bonadillo group, I'd be interested in, but I have no reason at this time to question the judgment of Heather Rand or our county attorney, so I can't support this.
Mr. Burke?
Not to repeat what others have said, but I certainly agree with all the comments that have been shared. The overarching goal here is for the benefit of our children, the children in our care. And not that optics aren't important, but first and foremost is the care of our children. And we have no reason to believe that those people that are providing foster care services, who are our employees, are not providing good quality care. So I'll be voting against this. Thank you.
Mr. Arquette?
Thank you, Mr. Chairman. I just wanted to quantify my vote against tabling. I I agree with the previous speakers, and certainly appreciate Heather's enlightenment on exactly what those statistics are. You know, but we've agreed as a group to spend taxpayer money on hiring a consultant to come in to help us with these issues, and by leaving the resolution on the table, did it not in any way jeopardize the future of the children that we're speaking of presently in the homes of people from protective services. So again, I agree with the previous speakers, but we've utilized taxpayers' money on professional consultants that are impartial. I'm certain that I would continue to believe, as the others have spoken, about this issue, but that was the reasoning for my voting against the bringing it back out onto the table. Thank you.
Thank you, Mr. Arquette. Anybody else? Mr. Manali.
I just wanted to say that I found it interesting tonight to learn about the parameters that are in place right now as a system of checks and balances to ensure that there is not a conflict of interest. And I know as we move forward, that our commissioner or deputy commissioner, once those positions are in place, will continue to ensure that we are making sure that that our employees that are fostering children, especially as kinship placements, they're not in a questionable situation, and we know that we are being fair and unbiased in our placement with workers, our own staff. So it was great to hear that tonight, that is in place.
Thank you. Anybody else? Mr. Ganesh.
I would not have supported the resolution had it been brought forward initially, because I thought it was premature. And I certainly would not support it this evening for the same reasons.
Anyone else? I'd just like to say that I think we've got an obligation here. We're spending money on a group that does investigations. And I think that jumping on this, if we were to pass it tonight, is putting the cart before the horse. We need to see what this organization turns up with regard to, different things with regard to social services, and specifically with the way CPS does business. I think that we would be wise to remember that we hear one side of a story in here. There's always another side, and we got a little bit of another side here at 2 meetings. I'm not saying that I'm making a choice right now as to where the truth lies, or where the accuracy of what we're hearing lies. But I think that we're duty bound to look at all sides of this, both sides of this. And as I said, we're spending a ton of money on an organization that will be looking at this. They will also respond to questions from us, which hopefully, if it doesn't focus them, those questions will, where we would like to get the information going forward. I think too that after hearing from Heather Ann this evening, that we can see that there's a lot of unintended consequences that can happen, that do get in the way of doing things. And those, I don't think have been brought forward and given the proper consideration. So I think there's a lot going on. What is the hurry to have this done now? Why not wait? We want an investigation, we're going to get one. And when that is complete, a report is submitted, then we can act or not act. If something happens in the meantime, we can act on that if it needs our immediate attention. So I won't be voting for this tonight either. I still think that there are some ethical issues with regard to this that we ought to be looking at. If we find nothing, we find nothing. If we find something, I think that we need to take a look at it. That being said, Mr. Arquette.
Thank you, Mr. Chairman. For point of information, I believe I misspoke I said that I did not support the bringing it back on the table at this point. But I believe I may have said, and if Kelly's could take a look back at the minutes, I believe I may have said that I probably will be supporting the resolution, which is not what I meant at all.
Okay, so,
That could be
thank you.
Thank you.
So we've got the table resolution is off the table. It's been discussed. Now is the time we're going to vote on that, okay?
Mhm.
So, all in favor of the resolution? All opposed?
No.
Aye. I think it's pretty much unanimous except for Ms. Curran. So it is 13-1.
I did
Against.
not vote at all.
Yes, I noticed that.
Well, I sent you an email about that, so.
Well, I wasn't going to get into the email that you sent me until we went into executive session. So you brought it up. Ms. Curran sent me an email and said that she was not going to vote. Let me get it up here and I can be 100% accurate. Ms. Curran, to myself on Wednesday, I just wanted to let you know, as the chair of the services, that I will be recusing myself from discussing that resolution or voting on it. I didn't hear you recuse yourself, so I assumed that you had voted no. So you did not vote.
I did not.
Okay. There were 13 votes, 13 no votes for the resolution. One legislator did not vote at all, and there's one absent. Okay. Moving on, is there any other old or new business? Seeing none, I'd like to point out that Mr. Reagan was excused tonight for personal reasons. And we now have need for executive session for
Following categories: litigation, personnel, which will include the medical, financial, credit, or employment history of a particular person or corporation, or matters leading to the appointment, employment, promotion, demotion, discipline, suspension, dismissal, or removal of a particular person or corporation, negotiations, and appointments.
a motion to go into executive session by Mr. Forsythe, second by Mr. Perkins. All in favor?
Aye.
No.
Okay.
Back on line.
Back online?
Yeah.
Adjourn. Okay, motion to adjourn, second